Very good evening, dear students. Um, how was your Rajasthan PSC? I hope you were able to perform well. And I figured the questions were very easy, or maybe according to the tough questions that you people ask normally. So maybe your level has upgraded as compared to the questions. So, so from the questions that we found, let's discuss them and let's figure out so, your answers. So, yeah, this is wrongly marked, of course, based on what we saw on the internet, and then we corrected it. So, odds ratio is equal to 1. Okay, so first of all, as we all know, that odds ratio is calculated in what study? It is calculated in the case control study. All right. And odds ratio gives the strength of association between the exposure as well as the outcome, right? So, what will be the values of the odds ratio? So, uh, if odds ratio is more than 1, here the answer is not positive association. The answer is no association. Okay, this is your answer. Okay, so basically, if odds ratio is more than 1, it indicates that there is a positive association. Okay, that means there is a strong association. Here we are seeing that how strongly. First of all, case control study is the study where you do not know the cause of the disease, but you will know that between the risk factor and the outcome, is there an association or not? And odds ratio is what will give how strongly the association is there. Okay, so if the odds ratio is more than 1, that means there is a positive association between the risk factor and the outcome. Okay, if odds ratio is equal to 1, there is no association. Okay, if odds ratio is less than 1, there is negative association. That means that there is a protective effect. That means if we are checking the association between smoking and cancer, so it will odds ratio less than 1 would be like that the more they smoke, the less the chances are of cancer. That this is the protective effect of the risk factor with the outcome. Understood? So this is what we understand by the odds ratio and its various values. Now, since here in the question they have asked us what do we understand by odds ratio is equal to 1. Okay, in that case, we will answer it as it is no association. Okay, these are like a fixed value. If you know this chart, and definitely you will answer absolutely correctly. Okay, so now the next question is again from the topic epidemiology, okay, which we have studied very much in detail in your live classes and also in your recorded. So this question says that the study which proceeds from effect to cause, okay, and its data analysis, what is that? First of all, let's try to figure out from the first step, which is effect to cause, okay. So now the disease which first of all out of case control and cohort, okay, which is the study which proceeds from cause to effect. Okay, so cause to effect is your cohort study. Cause to effect. Okay, it is your cohort study. Why? What happens that in this cause is that we are following the smokers. Okay, in smokers, when we see that over a period of time the development of lung cancer, so this is the effect. Okay, we follow the cases. Okay, we follow the cause, so we are proceeding from the cause and we are going towards the effect. Okay, whereas what we do in a case control study is we go retro. Okay, case control studies are also known as retrospective studies. Okay, and cohort studies are also known as prospective studies, or they are also called as forward looking studies. Okay, so in the case control study, it is retrospective study. Always remember that what we go here from, first of all, effect to cause. Okay, in this case we are going backwards and we are taking the cases of lung cancer and we are evaluating in them that whether they used to smoke or not. Okay, that is about case control study. Okay, now here case control has two options, one is relative risk and one is odds ratio. Okay, so basically what we study or how we evaluate the strength of the association in case of case control study is with the help of odds ratio. Okay, we do not calculate relative risk in this. Okay, so basically this is the right answer, which is case control and the odds ratio. Understood? Coming to the next question, an example of a reversible index. Okay, so now out of these, first of all, let us understand what is a reversible index. Okay, so now the classification of index, about the various types of indices, the classification was given on the various categories. Okay, there was one category which is simple and cumulative. Okay, simple said that whether a disease is present or not. That is the example of which is low incidence plaque index. Cumulative would say that the entire evidence of a particular disease. Okay, for example, DMFT index. It had the complete experience or the complete evidence. Okay, so that is a cumulative index. Okay, now then there was something called as based on the entity, so in which you are measuring the disease, okay, whether decay is present or not. Okay, then you are measuring the treatment part, so in this the F component was there. Okay, that is filled. And one was then in which there is a symptom would be say circular bleeding. Okay, whether bleeding is present or not. So this was one entity. The other classification was based on reversible or irreversible. Okay, so now this is on the basis of that your findings can be reversed or not. Okay, so for example, let's go to the first option, which is DMFT. Now we all know that DMFT stands for dental caries. Okay, this is an index for used to measure dental caries. Okay, now as we all know that dental caries is an irreversible microbiological disease, what we study in the definition. All right, so now when we speak about the dental caries, this is an irreversible disease. Okay, so now since it is irreversible, okay, so what will happen in this case is that obviously the scores, a tooth which is already decayed, can, if you mark it as D, can the D portion be reverted? Like if the D score is 1, can it be 0? It can't be 0. If the tooth is missing due to caries, can it, again, you've already marked that it is missing, can the tooth come back? The natural tooth can't come back. If the filling has already taken place, can you make the 1 to 0? No. So obviously it is an irreversible index that the findings cannot be reduced. Okay, DMFT is for measuring the tooth. DMFS is for it is the like if you're measuring the tooth in DMFS, you mark the tooth into surfaces. Okay, so suppose on the occlusal surface there is caries, so you will color the occlusal surface. So this is the same. Okay, here it is a surface index. Dean's index is a fluorosis index. Again, the fluorosis, when you see the mottling on the tooth or the tooth as deformed, so the fluorosis is also not reversible. Okay, so then the option which is left according to the exclusion here is Russell's periodontal index. Okay, why Russell's periodontal index? Because in this case what we do is that it measures both. It measures the reversible changes due to gingivitis and the irreversible changes due to periodontitis. But since it is measuring midway the reversible changes due to gingivitis, we would call it as a reversible index out of the options given above. Okay, so in this case what we'll have is the Russell's periodontal index. Okay, the next comes is the Albans test is an example of. Okay, so Albans test is an example of, okay, now what is caries activity? It is definitely an example of a caries activity test. It has been taught to you in the caries activity test. Now here I'll explain to you what is caries activity and the caries susceptibility. Okay, So by caries susceptibility, we mean that the inherent quality of a person to get caries. Okay, for example, the genetics of a person. Okay, that is caries susceptibility, where a person or a host is more prone to get dental caries. That is caries susceptibility. Caries activity is based on the microbiological component by the conditions of the patient, by the attacks and all of that. So that is basically caries activity. Okay, what we understand by caries activity is that in this we measure that how much prone a person is to get caries, or the increment of the existing lesions. Okay, increment of the existing caries lesions is caries activity. Okay, so this we measure. Here we take the microbiological counts, and that is done in the caries activity test with the use of various tests such as S mutans test, Albans test, lactobacillus test. We evaluate the activity of the organisms. Okay, so Albans test is an example of the caries activity test. Okay, coming to the next question, which among the following is the least biased study? So this is what I have written, that randomized control trial is the least biased study. Why? Because as the name suggests, in this we randomize. Okay, in a randomized control trial, okay, randomization, they say, is the heart. Okay, what we do in randomization is that the subjects are not aware that they will be put in which group. Okay, so we ensure randomization, and blinding is ensured in the randomized control trial, where the subject might be unaware which medication he's given. So because we do randomization, we do blinding, this is the least biased study. Okay, why what do you understand by bias? Bias is the systematic error that occurs during the study. So we ensure in this that the subjects at least are unaware of the treatment that is being given. Okay, and then there is blinding. Blinding is single blinding, in which the subject is unaware, double blinding, subject and the observer. Then there is triple blinding, that in which the statistician also does not know that which group belongs to what. So because of the blinding, we ensure that the risk of the bias is the least. Okay, so that is why the study which is least biased is randomized control trial. Okay, so these were all the questions which were asked in your Rajasthan PSC, and I have hence tried to cover all these questions possible. Okay, so I'm sure all of our students would have answered all of these in 100% result. So I think we can end the session now. 1 second.